see by the topic, headline, title, universal healthcare. First off, I want to say like and subscribe. I gotta say, everybody's saying it. Share the video, especially if you think it's interesting. And tell me what you guys think. So, all right. So, universal healthcare. Here's the thing. You know, you have to understand something, and I'm gonna try my best to cover all aspects of it, the good, the bad, because it's a really hot topic. But first of all, I want to, ask the question: why is it you think we don't have it? Now, you gotta understand. Like, I look at things at a business perspective, right? And let's pretend you can't rule anything out, right? Now, if you watch Michael Moore's movie, what was it, Sicko? And this is just, hypothetical, something that you cannot rule out. You got to think, these health companies, right? They all could get together and spill billions of dollars in the people's hands who decide whether we're going to have universal health care or not. $1 million here, $1 million there, etc., right? And you got to think, right? Oh, why would they give millions of dollars of their money just for a decision? This decision decides whether they're going to put them out of business in the healthcare industry. If there's universal healthcare, that means there's no need for private insurance. That means they'll go out of business. Yeah, they'll invest their money elsewhere, but as far as healthcare is concerned, out of business. Because the government's going to pay for it. Our tax dollars, right? Now, speaking of which, yeah, they might have to increase our taxes, but at the same token, we're not going to have to pay for private health insurance. We're going to get the same benefits that other people get from our tax dollars. Free healthcare, right? Now, if you don't work, or if you're government assistance, you're living for free, you're getting money from the government, you're also going to get free healthcare. Now, if you work but you don't make a lot, you're also going to get free healthcare. It's just part of the system, But now everybody's going to get the same free healthcare. There is no okay, he has the better health insurance, we'll give him the premium stuff. No, everybody's going to do the same thing. Everybody's treated equal. So, that's the good thing, right? And the other good thing is that everything and it's expensive. Like, every treatment you could think of, like, just to put an IV is expensive. So, with the universal healthcare, everybody's got the same treatment, and with that, the all these things that, the government's finally going to say, wait, why is it that we're spending this much for this? So the thing's gonna get a little regulated. The hospitals are not gonna gouge the price, because it's ridiculous. You watch some shows on how or reports on how they charge you like $1,000 for a hospital bed. Like, really? You know what I mean? Like, it's just ridiculous how and they get away with this too. So with the universal healthcare, the government's paying for it. You know how it is. The government's gonna be like, wait, hold on. Why is it that we spend it? No. This is not what we're gonna do. All right, this is what we're gonna do. We're gonna get the cheapest one. Whoever gives the best thing wins for all kinds. So, and it's not like a private thing where, if let's say a company A has a set amount of things, then this hospital will buy it, but then the other hospital will get the profit. And it's like each company could make business with different hospitals. No, it's one government. Like, all right, this is what we're gonna do. Whoever gives the best price, they're gonna get the deal for all the hospitals. So that one company is gonna be. So they're all gonna compete. It's gonna be a real thing, and they might all compete for similar prices. All right, well, you can obviously make enough at a certain time, so we're gonna contract with you and you, and you're gonna match the price. We'll contract with you. They're not gonna have a choice, because who else is gonna buy it, right? So they're all gonna settle for a certain amount. You know what I mean? So it's gonna bring costs down. They cannot gouge the price. It's just a lot of cost factor in there, and it's not gonna be it's not gonna be profit. It's gonna be strictly, it's gonna be treated as non-profit because basically the government is paying for this, and the government is not gonna. I mean, the government, I don't know, they're not gonna gain money anywhere. It's all tax dollars. So it's just one of those where over time the cost of healthcare, it's going to be a lot cheaper, and then the government is not spending as much on healthcare as private companies are. So if a private, let's say average person spends $150 on private health insurance, that $150 realistically will probably cut at least by half over time. That's just my theory. I don't know too much. This is just like common sense theory, I guess, like just what I'm gathering. So that's another thing. Now the bad, right? Let's talk about the bad a little bit. They say that, you're gonna have longer wait times, but guess what, right? It's bad and good. Here's why. Why is it you think we'll have longer wait time? Because everyone is covered. Whereas other hospitals like, well, not everybody's covered, so it won't be as bad. People are not going to spend an arm and leg, so they'll go to the doctor more often because they're not going to pay for it. It's just part of their tax dollars. Tax dollars paying for it. So obviously you're going to have, it's like Six Flags, for example. I mean, this is just a good analogy in my opinion. Six Flags, you're not paying per ride. So guess what? The lines are going to be a little bit longer. Whereas if you're paying for each ride, the lines may still be long, but it won't be as long because people are gonna be like, I could just get on the rides back to back. I'm not paying for it. Let me get my days used out of it since I have the season pass. So you're not literally it's not literally coming out of your pocket each time you get on a roller coaster or whatnot. So obviously the line's gonna be a lot longer, and that's how it is kind of with the health insurance. It's like, all right, it's free. I might as well set the appointment up. I'm not paying I'm not paying a co-payment or anything. It's free. So that's why the wait time is long. Now, to combat that, it's not an issue, right? All the government got to do is build more hospitals. If there's a long waiting line, then build another hospital. You got to satisfy, the people like to work on. And now, again, this could be a problem. I get it. But now it's the government's responsibility to fix that problem. So if it's still a problem, you got to figure, okay, if New York City trains are overcrowded and they're only running a few trains, but they could fit more, but they're not going to because it's costing them money. So they're gonna cram each, they're gonna squeeze each train for the most they can, and if it's overcrowded, it's overcrowded. No, they got to put more trains as long as they can, right? They got to put more trains that's reasonable to satisfy all the customers. So it's just that simple. It's just that they have to do that. And if they don't, that's the government's fault. It's not the universal healthcare's fault. Now, that's just that, right? The cost of medication. Now, we all know that medications can be very expensive. They gouge the price, and people need it, so they pay for it, especially when it's like a patent medication where that's the only brand and they don't have generics or whatever cases, right? Or knockoffs, whatever. So not knockoff, whatever you call it, when they have other brands that gives the same thing. But with the government being the person who's buying these medication, they're gonna regulate this. They're gonna be like, no. Wait, you're charging us this much for that? You know what? We'll go with the other brand. It'll be a lot cheaper. And then now the name brands are forced. They're gonna have their hands tied to compete. If not, they're gonna go out of business. So it's just like it's real simple, guys. It's really simple. The government's gonna force prices down because they're not gonna spend. They're gonna look at it like, no. We're not spending that much money on that. We're gonna go with these guys. Automatically, things going to go down. So the cost of healthcare in general is not going to be what it is now, because the government is not going to take that. So you guys got to understand, universal healthcare all around is going to be a very, very, very good thing, in my opinion. Now, again, the bad thing is probably going to be the whole wait time. But look, you got to understand, Canada and other European countries are doing it. If it's really that bad, they will find a way around it. You know what I mean? It may be very dependent on location. But it can be bad to a point where, you know what I mean? Like it's not manageable. That's my guess. That's just my guess. And then you got to think, are all the countries with universal healthcare having the same problem? Which one is not? What are they doing different? Just you have to take errors from other. You know how you learn mistakes from other people. That's what the government have to do. They have to see what they're doing right, what they're doing wrong, and fix it. You know, and I don't want to go off topic, but I mentioned this same thing with crime. Like, you got to figure, other countries may have low crime. What are they doing different? Is it the system, the jail system? Is it the police system? Is it the laws? Is it the penalties? There's something that's made. You know what I mean? What is it? Because if it's not any of those, then it has to do with genetics. It's just that, are we born in the USA to commit more crimes? Is it nature? Is it nurture? These are questions you got to ask, right? So same thing with the universal healthcare. What is it that these other countries are doing differently than ours? And the government got to take that from everything, not just healthcare, not crime, anything that's they doing differently in other countries and they doing better, or they top of the line. And you know how they compare, the USA is number one in this or infant mortality, or best in healthcare, best and GDP, economy. It's one of the biggest things they compare with other countries. US is not like down on the list, but I don't think it's number one. Maybe it is, but you know what I mean? Like, you understand, what is it that we're doing different than other countries? Anyway, I think I'll leave it off there, so it's not too long of a vlog. It's already 12 minutes. Tell me what you guys think. Give the thumbs up, like and share, like I said earlier. Leave your comments and thoughts. What I want to know is, do you guys know anybody in Canada or any other country that has universal healthcare, a single payer system, not the two-tier system? That two-tier system is a whole other story. That's like, I didn't even know what that was. I googled it. Basically, a two-tier system is universal healthcare, but you have the options to purchase private insurance for a better service, or luxury, I guess, service. I don't know if it's a better room, better equipment, whatever it is. And that's they still have private insurance, but you know what I mean? And I can see the US going into that. I could definitely see the US going into that one. But there's a two-tier system where you have your universal health care, then you also have the private insurance for better service, I guess. If the United States gets universal health care, I could definitely see them going that route. But to me, I think the single taxpayer system, everybody gets treated equal. Everyone's equal. There's nobody who's going to get better treatment because they have a better service. If anybody's sick, we're all going to get the same treatment. Fairness, equal. We're all equal. There shouldn't be, he's paying a little bit extra. Let me give him the better room. Come on, man. We all sick. At the end of the day, we all should have good rooms. It shouldn't be like, all right, you get the crap and you get the good. No, they all should be good. Everybody should be treated equal. That's all I'm saying. It sounds like a socialist thing to say, I guess, but, my whole point is that there shouldn't be a bad enough to a point where you say, you know what, let me get the premium. Because all of it should be premium, is what I'm trying to say. That's all I'm trying to say. And if you feel like it's not premium, then that's something that, you know what I mean? You know what I'm trying to say? Like, it shouldn't be like that. You shouldn't feel like it's not premium. Anyway, Like and subscribe. Thanks for watching.